Hello and welcome to series of lectures in anesthesia and intensive care medicine. My name is Dr. Ayyaz, and today we will talk about basic life support. In this lecture we will discuss how to perform BLS during examination. Basic life support is the type of care that first responders, healthcare providers and public safety professionals provide to anyone who is experiencing cardiac arrest. To perform BLS during exams, you will be provided a written scenario. Your goal is to just simulate the real scenario. No mouth-to-mouth breathing should be performed. BLS algorithm without use of automatic external defibrillator is very simple to remember. The step 1 of the BLS is check for safety. The step 2 is recognizing the cardiac arrest. The next step is ask for help, ask for AED, and then activate the emergency service. After activating the emergency service, immediately start chest compression. So let us start from step 1. How to check the safety. Make sure that you, the victim and other bystanders are safe. During examination, you should check the safety by watching around the mannequin as shown in this video.
So when you will enter in the room, there is the mannequin in your exam. When you will enter in the room, you have to check. The first step is safety. You will check here and there. It means you have checked the safety.
If the scene is safe, then immediately proceed to next step, recognizing the cardiac arrest. If victim is unresponsive and not breathing, or breathing is inadequate, it means he is in cardiac arrest. To check the responsiveness, ask the victim, "Are you okay?" Then shake the shoulders and ask again, as shown in this video.
Next step is, I will check the response. Are you okay? Are you okay?
If the victim is unresponsive, then proceed to check the airway and breathing. Position the victim on his back. Perform head tilt chin lift maneuver to open the airway. If airways are clear, then look, listen and feel the breathing for not more than 10 seconds. A victim who is barely breathing, or taking infrequent, slow and noisy gasps, is not breathing. Watch this video, how to assess airway and breathing.
Check for breathing. I will put one hand on the forehead, other hand below the chin, head tilt, chin lift. I will open the airway. I will check inside. Nothing inside. It means airway is clear. Next thing is, I will check the breathing. Look, listen and feel the breathing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So I checked for 10 seconds the breathing. I observed the chest movement and listening the air which is coming from the mouth or nose and feeling the air. So look, listen and feel for 10 seconds for breathing.
Step 3. Ask for help, ask for AED, and activate emergency service. If the victim is unresponsive and not breathing, it means he is in cardiac arrest. So your next step is, shout for help, ask someone to bring AED, and immediately call to emergency service. When calling to emergency service, provide them your location, address, floor, room, gender, approximately age of the victim, and tell them that victim is unresponsive and not breathing. Activate speaker function on your phone or hands-free option so that you can start CPR whilst talking to dispatcher. This step is shown in this video.
So next step is ask for help. So you have to shout, "Help, please bring AED," and will put your phone, start calling to emergency number. "Hello, I am calling from MSMU 3rd floor, 2356 room number, main campus, Troitsky 51. There is 30-year male is lying down. He is not breathing and unconscious. Put your phone on speaker."
After activating the emergency service, immediately start chest compression. Kneel by the side of the victim. Place the heel of one hand in the center of the victim's chest. This is the lower half of the sternum. Place the heel of your other hand on the top of the first hand and interlock the fingers. Keep your arms straight. Position yourself vertically above the victim's chest. Push straight down, aim for a compression depth of at least 5 to 6 centimeters. After each compression, allow the chest to recoil without losing contact with sternum. Repeat the compression at rate of 100 to 120 per minute. Push hard and fast until you see obvious signs of life or until emergency service arrives and takes over. Watch this video of this step.
Compression. Put one hand on the middle of the chest on the sternum. So if you see, this is the chest and middle of this chest is sternum. Put one hand or just 2 fingers above the skirt process. Put one hand on the sternum, not on the ribs. Put other hand on the first hand. Straight your hand. Put the weight on the patient and compress 100 per minute. And depth should be 5 to 6 centimeters.